Hello, everyone. Just getting myself organised. I'm going to pin me. Apparently, that's what I'm supposed to do. There we are. Good. Hi, everybody. I hope everyone's well. I will start in a few minutes, but what I'm going to ask you to do, if you can, make sure you're muted. I think everybody is, but can you get yourself set up? So I'm going to do this lying down, but you can do this seated and then replay it doing it lying down, okay? Now, Simone's my lovely model, and what I'm going to do is if you grab a towel or a cushion of some sort, and I'm going to use the Coast Makalu, the white ones, but if you don't have them, that's fine. Use your blue, pink, black, whatever you have. What I'm going to get you to do is just get your two middle domes out. So remember the two middle domes. We are going to use mainly those two for this series today. Okay. So I'm just going to check the timing. I actually don't know how many people are going to be on this session, but the recording will be shared. So I was almost going to dub this course if something's up your nose, but it may not have been appropriate. So what we're going to do, if you can, is I want you to start, first of all, we're going to do this seated. So I want you to take your middle dome and your white dome. Why do I wear white when I'm using it? So you're going to take those two domes and put them in like you've got a little open planet, okay? Now, we're going to start this because we're just going to do a little bit of a release into your pec muscles. So Simone, lift your arms up. You're going to put the little one in underneath the armpit. I know you're all going to be, Carla, how does this relate to sinuses? I'll explain in a minute, okay? So we're just going to do, now in my file notes, I write this as little boy farting. So you know how little boys go like this? So, so you're going to just press in and squeeze. Is that okay? Mm-hmm. And back. So you might just want to roll the palms up and out, okay? And the idea is here that we're just trying to release or trigger in at the same time. Yeah, if you can, coordinate it. What we're trying to do is work on releasing through your pec muscles, okay? So remembering your pec muscles, deep muscle in here is part of your breath muscles. So when we're talking about your sinuses, we're talking about how we're trying to get you to breathe better, but also to relieve a number of other muscles that can have trigger points that refer into your sinuses, okay? So starting point, pecs, okay? How does that feel?
Yeah, good.
Now remember that your pectoral muscles also come in and attach underneath your clavicle or collarbone. Now, I'm going to nag you about that because the way your collarbone sits is going to affect a number of your neck muscles. And when the neck muscles are affected, there will be referral into your sinuses. So I'm going to remind you, your sinus muscle, your sinuses and the paranasal sinuses are going to be the focus for this session, can actually be A, infected and all, or B, the sinuses could be affected because of trigger referrals, okay? So I just want you to understand that there could be a number of different reasons. We're just going to relate to these two. So first, just releasing your pec. So next, I'm just going to let you take that out. Just take a moment and feel how you're, oh, nice. How's that feel?
Yeah.
So the next part of what we're going to do before we lie down is we're going to work into your collarbone, into your subclavian, okay? Now, Simone is lucky. I'm going to let her lie down. But for you, if you want to do this while I'm talking, what I want you to do is start with the middle dome. And I like to have my hands on around just so that it's easy to rest. And you're going to get in just around the acromion process, just around that collarbone, and then you press up and in. Is that okay?
Mm-hmm.
And then you're just going to move up and along the collarbone. Okay, now what I like to do, especially because we're working a little muscle and fascia, remember, is important. You're going to press up into the collarbone and then dial that along towards the sternum. Does that feel okay?
Mm-hmm.
Now, just remember, for those clients of yours that do this, who have had breast cancer or a number of other types of head, neck, and throat cancers, this area is often cleared, the nodes are often cleared, okay? So this could be a little painful or a bit swollen around here. So just be careful, but this is just a very nice way to get that fluid moving, okay? How's that feel?
Good.
So, yeah, look at that. Okay, can you see your shoulder from side to side?
Yeah.
So can you just do the other side? So just, again, if you're doing this with a client or you're doing this at home, probably do 2 to 3 each way. We're just going to make it very quick along here. So I'm just going to, while Simone's just doing this, I'm just going, in the blog that this video will be dropped into, you'll find references to trigger points. Now, this isn't very well seen here, but you will see in your trigger point charts, or if you go to triggerpoint.net, you will see a whole heap of places which show the trigger points for your sinuses. And probably the big ones that I want you to understand from the neck point of view is from your sternocleidomastoids and from your digastric muscles along here, okay? How's that feel?
Good.
In there. So just do under the collarbone, just releasing through there so that you get to that point of your sternocleidomastoid. Now, Simone, you get to lie down.
Yeah.
Now, yeah. So I'm just going to set it up and I might just bring this in. So can you see, Simone? I'm going to put a towel here so that she's going to be in a slight extension of her head, okay? Just there. Now, I might just bring the camera forward so you can see this. I'm sorry, this could go terribly wrong, but, you know, you'll understand. So I'm just going to bring it further forward. Can you see that? If you can't, turn your video on, your audio on and tell me, okay? But I just want to make sure you can see Simone's face. Okay. So the first part of what I want you to look at here and understand is that we're just going to do some nice release work around her sternocleidomastoid. So remembering that's the muscle that starts here at your sternum and coming along here. So what she's going to do is just put her head on the side here. Hers aren't too ropey. So when you do this for yourself, what I want you to do is just get the middle dome and sort of put your hand at your clavicle, at your sternoclavicular notch here, to sort of almost fix this muscle. And you're just going to, as Simone inhales, I'm just going to slide this up. Okay. She just melted like a cat there. If you're doing it, just do it like that, okay? So just sliding. Now don't go too heavy. And when you do this, you sort of tilt your hand along, sort of sliding and enjoying the edge of the muscle, okay? Nice. How's that feel? So then just go to that side, turn your head the other way, and I'll do the other side. Now, just remember, this can be a bit ropey and painful for someone. So you might want to be a little careful and get them to make sure they breathe. And you might not fix it. So when I say fix it, I'm just sort of stopping the muscle from sliding too much. It might be that you just let them do it this way to start with, okay? How's that feel?
Lovely.
Okay. So just have a moment and just even turn your head from side to side, because that will give you an idea, because the sternocleidomastoids or SCMs can impact on how you turn your head. Now, The next part of what we're going to do before we start getting up into our paranasal sinuses is we're going to work on releasing some of the superficial muscle of the neck and jaw, because that can also be working into that trigger points here. So the first one, the most significant one that I want to work on is the platysma. So what I'm going to get her to do is I'm just going to put the middle one here, and I'm going to just slide it down. Now you can use your hands to do this, but I find that with the hands, people who have a lot of face type sinus issues or autoimmune condition problems, they have lost sensation on the fingers. So pressing down can be a bit painful for them as their home program. So I use this as sort of a cupping sensation to just try and help them slide that down, put a bit of tension again on the platysma. Now, Simone, you're going to bring your chin to your chest as I slide the sternum down. Good. Open your mouth. Take your mouth back. And now you're just going to open and close your mouth about 5 times, like a little goldfish. And you should feel a nice stretch through the front here. Then what you're going to do is turn your head to the side. Same thing, open and shut your mouth. Then turn your head and rotate it down so you're looking down at your armpit, and open and shut. So now we're getting into the sternocleidomastoids a little bit there as well, okay? Now remember that people with torticollis will have a lot of problems with their sternocleidomastoids, so you might need to be careful on some of these options. Good. Now bring your head back to center. Yeah, how does that feel?
Good.
Yeah, you tolerate me doing some more?
Yeah, it's a really nice stretch.
Okay, so we'll do it again. So she's just going to turn her head towards me. Open, close the mouth 5 times, like a little goldfish. It's always nice to see how many fillings your clients have. And turn your head down and rotating down again, just sliding, very gentle. Okay. Good, and then back to center. So open and close your mouth now without that. Does that feel a bit easier? Mm-hmm. Okay, so we're starting to release any of the trigger point muscles that could be referring into the sinuses. Next, before we go too crazy around the sinuses themselves, we're just going to work around the digastric muscles, again, which can be part of these triggers. So grabbing your middle dome. Some people you might want to get the little dome, but I'm just going to be gentler today. And I'm just going to start here around the edge of the mandible, just at the attachment point of that SCM, okay? And what you're going to do is just grab the dome and lift it up into the edge of the jaw, just like you were doing with the collarbone, okay? So you lift it up and then you dial it just a little bit to the chin, okay? Does that feel all right? And up. Yeah, good. Okay. And then lifting up. Now someone sent a message and I can't read it, so you might have to, I can just see a message is sent there or a chat request. So if you want to ask me, I will be with you in a sec. So Simone, can you just keep doing that? And I'm just, sorry, this is where you discover how useless I am at technology, but that's okay. Yeah, so everyone, don't worry, I will share the video of this. I will download it into Vimeo and I will share the video, and I will also drop this into a detailed blog that I'm doing around the sinuses as well. It might just take a day or two, okay? Bear with me. How's that feel?
Lovely.
So again, if this is causing any pain, I need you to tell me and not keep pushing yourself to it.
Good pain.
It's good pain. So we've gone under the jaw. Now I'm going to go on top of the jaw, okay? And you're just going to do the same thing. So it's just on that top point. And again, now what I'd like you to remember that part of what we're working on here is the trigger points of the muscles, but we are also working on some of these points that form part of your autonomic nervous system. So I've just worked along here and I'm just very gently doing the same thing. So remember, the autonomic nervous system is part of our stress, flight, fight response. And there are a number of cranial nerves that form part of that stress response. These nerves trigger straight into our brainstem and they influence our eyes, our saliva, and also just the way all of our immune system works. So part of what we're working on here, as I go along the edge of the jaw, is we're also trying to release some of the pterygoid sinuses, or that's probably not the right word to it, but we're trying to release some of the parotoid, not pterygoid, parotoid salivary glands, okay? So we're just trying to help stimulate that in a nice way. How's that feel? Okay, so take a deep breath in now and just observe, okay? Don't judge, just observe. So what I'm going to get you to do next is, so we're coming up, okay? So I want you to remember that with our sinuses, we have these sinuses here, these sinuses here, and they're all part of the sinuses. There are 4, but we're just going to talk about them as this and this. These sinuses help create resonance in our voice by allowing the air to be there. They help to make our skull lighter, but they also produce the mucus that catches all the germs. So when they're infected, they can actually make us sound a bit weird, but they can also stop us breathing well. Breath is important. So the first thing is, so we started on the jaw. We're going to now find your cheekbones, and you're going to start doing the same idea of lifting up into your cheekbone and rolling down. I know the camera is not on me, but I'm not important. It's Simone's face that we need to see right now. So I'm going to get you to go from here and to here. So just using the middle dome. And again, I like to sort of lift it up and drag it round. And then you're just going to press it into the edge of the nose as well. Okay. Take a deep breath in. So then I'm just going to breathe into that side. And then press in and breathe into the other nostril. So I know it feels like we're doing a pranayama yoga when you do that, but does that feel okay, Simone?
Mm-hmm. It's like a face lift.
Yeah. We're just going to go there. And then just following the cheekbone, just sort of triggering along the edge of the face. I know this stuff doesn't look very exciting on Facebook or Instagram or whatever, but I can tell you it feels fantastic. Okay, good. Deep breath. So again, I would probably do about 3 each side, but you know, you can do this at your own pace. So the next thing I want you to do is grab your smallest dome, okay, the littlest dome. And what we're going to do now is actually work around the orbit or the eye bone. And the orbit is part of all of these bones that form the sinuses. So that we all know that when your sinuses are blocked and you're feeling all yucky, you get that lovely baggy, you don't have it. So You get that lovely black baggy line around there. So this is aimed at helping those clients release some of that. Okay, so what I'm going to do is I'm going to use the littlest stone, and I'm going to start just at the corner of the eye there, and I'm just going to sort of roll it with the pressure that you feel comfortable with. So it's not that creepy sort of fingery sort of, you know, that feeling where you go to a massage and you feel like you're just that creepy fingers. There is a bit of tension in there, but go to your level of tolerance. Is that all right?
Mm-hmm.
And then you sort of follow just above the cheekbone here. And again, you're just going to roll. So some of you might find this quite painful. I'm sorry, but you'll just have to do it. But the idea is that what we're trying to do is just sort of work through any of the blocked up sinuses here. And you'll find that for some people, there might be polyps in the sinuses, and that might feel a little bit icky in particular for them. So now as I come towards her nose, you'll see that I'll sort of slide it along and up the edge of the nose, okay? Oh, yeah. I have my hand on the other side of her head so that she doesn't roll around too much, but if you're doing this yourself, just be trying to keep your head still, okay? Is that all right?
Mm-hmm.
And then I'm just going to follow this along. Now, where I'm sort of following along is the major bone, the nasal and the ethmoid bone. And they form part of the sinuses, and that can feel a bit icky just around here. Is that okay?
Yeah.
So just at the edge here between, well, ideally you have space between your eyebrows, okay? But if you don't, it's where you should have space, okay, between the nose and the eye. So what we're going to do is just there. And I often find that this little spot here is just a bit icky for a lot of people, okay? So this is just around the top of your ethmoid bone and where your sphenoid bone meet, and it's around the point where your pituitary sits. Okay, so Simone, does that feel okay?
It's like trigger point, but it's good.
Yeah, so it's one point that you might find that you might just linger, okay? Just enjoy that, but as you do so, don't just press down into it. It's a sense that you sort of roll in and up. So you roll in and you roll up into your eyebrow. Oh yeah. Okay. And so then again, this is the sort of one that, and then I just keep rolling up into the eyebrow, and then you'll just sort of lift up and into the eyebrow as you go around. Is that all right, Simone?
Mm-hmm.
So this can get a bit painful. So I find that it's better to just press it in, then roll, then go back again, lift it in and roll, okay? Simone was saying to me, should I be wearing eye makeup? And now she's understanding why, why she was asked not to wear eye makeup for this. Okay, good. And then you come back to your starting point. Now again, I would do this about 3 to 4 times on one side. How's that feel?
Yeah, no, it's good. That's what you were saying. That was the most tender.
Yeah.
But it's a nice release.
Nice, right? Yeah. What you might do is then get your middle dome and then just sort of slide along. So you sort of slide the sinuses along, okay? Try and get that fluid that you just released and just slide that down towards your ears, okay? Nice. You don't need a facial this week.
No.
Okay, good. Take a deep breath in and out. Just again, just put one hand on your nose and just breathe on one side of your nostril and then the other. So if you're really blocked up, you've got a lot of that asthma sort of responses, you'll find that this is just a bit too intense. But so I'm just going to work on the second eye. Just observe, don't judge it. We might work a bit faster on this. You're going, yes, Carly, you're working on the second eye. I've got a party to go to. I know it's Halloween, and so some of you are thinking, oh, those black lines under my face would work really well for Halloween. But let's face it, we all want to look kind of glammy in our Halloween costumes. in my eyes, in my head, I'm always Catwoman, but I always look like Elephant Man. Sorry. And just sliding along into the nose and then sliding it up. Good. And then we're sliding it up. Just into your eyebrow again, just going around that little point at the top of your nose to your eyebrow. Sort of lifting it, pressing it up into your eyebrow and around. So you sort of get this nice little twisty feel to it. Okay, yeah, good. This side's a bit better, so it didn't seem as blocked. Okay, so again, 3 to 4 on each side. Just take your time. Remember to do a little bit of a slide along your cheekbone and the sinus to try and move any of the fluid build up or back up. Okay. Now, of course, what I would be doing with clients if I'm doing this work, this might be, say, 10 minutes of work with them that initially, and then I'm going to give them some exercises to try and help build breath and also build neck strength. But for now, we're just going to work from there. So what I've done is I've just got the middle dome now, and I'm just going to put it on the third eye bit, just around that bit that was a bit icky. Is that okay? Mm-hmm. And we're going to now sort of slide it back along the skull. And we're going to come through to the top of the skull, okay? This may feel a bit icky for some people, but we're working along the frontalis muscles here. Again, these points can be a trigger for a lot of sinus and sinus-related headaches. So we just want to make sure we go gentle. Is that all right? Now we're just going to work along your tiara line. So along the side of your skull, just roll it down and around, and then down and around. Okay. Just above your ear. And then just bring it back. And then up just along the top of the forehead, just trying to work on release. Now, I'm going to nag you all about this. This sort of work, and releasing through the frontalis and releasing through the sinuses, after I've had a client do this sort of work, I do not want them to do any sort of calf stretching or raising or any work on their big toe, because there are trigger points or reflexology points, more correctly, in our feet that can trigger your sinuses, and in your calf that can trigger certain headaches. So I would say that after you've done this, no calf stretching for 24 hours, and careful on doing any sort of standing on your big toe, especially in the base, or pressure points into your big toe. Is that okay? Unless you're seeing a proper reflexologist and they'll know what we've done, okay? Or a proper acupuncturist. Remember, there's a difference between acupuncture and dry needling. And what we're really working on here is your acupuncture or meridian points as well. Nice work, Simone. How's that feel?
Lovely.
Okay. All of you just stop, just take a nice deep breath. Just check in, feel how your sinuses are feeling, how your breath is feeling. There's a whole heap of extra work that I can do with you, but I'm just going to do a final one because I feel like when we do this series, it's almost essential for you just to do this, allow your body to adjust before and not go too many times, But remember, we are only doing 1 repetition of each of these moves. When you go back to do this, I'd like you to try and do this where you do 3 repetitions of each. So the next and the final joy is I want you to get your 2 middle domes, and I call this almost like a reverse of Princess Leia. You know how she had the hair like this? I want you to put the reverse so that you're going to put the domes into the cheekbones. You're going to lift the cheekbone, it up into the cheekbones, and then you're going to almost like you're dialing the cheekbones together. Oh, is that okay? And you're sort of rolling them forward towards the nose. Really pressing in and up, and then release. How's that feel?
Feels like moving in my nose.
Good. So that little series that we just did then, that final little bit, was just doing the final sort of trigger at the sphenoid bone, which is that bone that sits around the orbit and that comes up here where your pituitary sits, and it helps us just release through some of these, that last little bit of the bone and muscle that might be tight. I'm not manipulating the bone, but I'm just trying to release some of the muscles around there so that that bone can just go, oh, yeah, I'm happy. And so I can start to work in there. How's that feel now?
Lovely.
Sit up and show them how beautiful you are now. Even more beautiful. Okay, I'm just going to fix the camera. And then, look at you. See, if you go back and have a look at a face later, and also look at your own faces later and see how that feels. Do you have, oh, look at this, young people everywhere. Turn your audio on and ask any questions that you need, because I think we've managed to get through this much faster. Good. Anybody questions? Does that all make sense?
That was good.
You can turn your audio on. So remember, the things that we've just done have really been aimed at releasing the muscle. Remember that our muscles of our face attach in to the skin. So it's very different to anywhere else in our body. So the trigger points have a much more direct response to the way the bones and the skin are sitting. So as we work through that layer of the face, we're working very differently to as if we were doing a stretch on the calf muscles or things like that, because it's not bone to bone, it's bone to skin, okay? The sinuses are part of our immune system, and their infection or it's a part of a response of something that's going on. So when we're working with them, I am wanting to actually help do the release of it, but I'm also wanting to work through the autonomic nervous system aspect. And again, I know I nag about this, but autonomic nervous system is part of how our body copes with stress, and how our body copes with stress affects how your immune system works. So remember, what's this? Do you know what this is? You know what this is? This is called a vicious circle, okay? And that is what can happen when we've got infections of our sinuses and infections and things like that. And we don't want to get into that vicious circle where it gets sick, or we get more sick, or we get more stressed. So doing that there. All makes sense?
Yep. Very good.
Thank you, everyone.
Thank you
Go
very
have and, get beautiful for Halloween. Bye.
much.
Thank you.
Bye, Carla. Next time, see you.